Today's episode of the Gestalt Education Show is brought to you by three of our favorite sponsors: Human Locomotion, Core 360 Belt, and Dynamic Disc Designs. All the information can be found below. By now, you have definitely heard us talk about them, so check out the show notes, click the links, use the codes, and make sure you support our favorite people. As always, we got a great episode lined up for you today, and thanks for tuning in. All right, everyone. Welcome to another episode of the Gestalt Education Show. Today, we're back on home turf. Today, it's All-Star Weekend, Brett, and so I figured today would be a perfect time to dive into one of your favorite subjects, or maybe not so favorite subjects, but that's baseball. And so we have an upcoming DNS Baseball seminar that we're super excited for. It's going to be in just on the outside of Chicago, August 23rd through the 25th. And this is one of my favorite subjects or favorite seminars that you teach, which is DNS Baseball, because it's a lot of all-encompassing. It kind of adds in acute care. It adds in DNS's kind of role in the rehab. It adds in maybe some injury prevention or, protection, and also just some biomechanics talks. And so I know this has been a long time coming to you kind of designing this course. And I know that there's more coursework down the road, but, for those who don't know, Brett, how'd you get your start in baseball? And we'll kind of continue the conversation after that.
I think like in our areas, here we've homegrown a lot of good baseball players, and it's like when people ask like, how do you work with high level baseball players? Well, you got to start with the kid that's in front of you. So I feel like at a young age did a good job with the person that was in front of me. Did a lot of stuff that a lot of people wouldn't want to do that you probably don't know about. I was down at all the baseball academies down in South County, just logging hours and, just kind of understanding what the injuries were, understanding how to treat the injuries well, probably. And then I started just like really kind of diving into the biomechanics of pitching, later dove into the biomechanics of hitting. And then that's kind of where it is. I mean, baseball is really unique because you have this story to tell that's a little bit romantic. One, baseball is pretty romantic in general, it being from the United States. And then on top of that, you have this epidemic injury that no one's got a great answer for. The DNS doesn't have the whole answer, but DNS has got probably, we always say, like, if you're looking at a pie chart, the biomechanical part of it is going to make up, between 75 and 80% of that pie chart, and then we have the ridiculousness of how much people are throwing. You have the metabolic cost, you have autoimmunity, you have all these other things, workload. But I mean, at the end of the day, like the mechanics actually do matter, and so we, the big thing is not that we're working with half the MLB teams. The big thing is that we're hopefully starting a movement in the younger generations. That way we can, get this right from an early age. That way we can, we don't have to be changing things down the road. And I think that's kind of where the movement is. The movement, honestly, especially at this point in my life, is not about the whole pro thing, although we do need that for the street credit. I mean, I'd be a fool to tell you that we don't, because that's what gets us the street credit. But really, the movement is to teach a seminar and have these people go back to their hometowns and like spread the word.
Well, I think it's a good point. It's we always make the argument, you have a $100 million pitcher that's pitching tonight or whatever in the All-Star game. So who are you to say that their mechanics are necessarily bad? So, as the evolution of the Tommy John surgery has come, it's a really successful surgery. It's almost too successful for us.
Yeah, we hate how successful it is.
Yeah, you're off a year, but you come back, you throw harder usually, and you usually get another, 5-6 years out of that.
On average, 7,
yeah. So, you make another 7 years, that's another contract, that's another $100 million. Your kids don't have to work. And so I think it brings up a good point, and maybe you can talk a little bit on the mechanics of what we're looking for, but making the changes at a younger level make a lot more sense. Or maybe in those guys that are like right on the cusp of getting that major league contract, that those are the people that we can make the biggest changes with.
Right. Yeah. So, I mean, just a little bit of history on the injury. So the first surgery was done in 1974 by Frank Jobe on Tommy John. So Tommy John was the patient whose career was basically, riddled with, elbow pain and injury, and no one had officially described the injury. So on basically a whim, Frank Jobe, he, does this exploratory surgery And what's really unique, and I mean, we've had James Andrews on here to talk about it, George Paletta. We've had a lot of people, the experts in the world that have talked about this. The amazing thing about this surgery is like it hasn't actually changed that much. Now, we have different camps. Some will move the ulnar nerve, some won't. But at the end of the day, the tunneling procedure is different depending on who does it. But at the end of the day, this surgery is really not all that different than the original one that was done, literally, we just had our 50-year anniversary on it. So that's what makes that procedure kind of unique. But like you correctly stated, we kind of hate how good the surgery is because now, and this has actually been research where they actually have determined that most parents think, not most, half of parents believe that when you have your Tommy John surgery, you're actually improving your son's performance on it. So it's almost like you would prophylactically get Tommy John surgery to make this better. And this research was done and where they sent surveys out to parents. I mean, this is actually a proven fact. Mm-hmm. And James Andrews told us, I mean, they're doing Tommy John surgery is on like 9-year-olds now, mm-hmm. which we all know that's insane. We're all in the world. I'm in the world myself with my son. We don't know what to do about it because everyone knows it's ridiculous, but you're in the middle of it and you're trying to figure it all out. And Glenn Fleissig, by the way, is the reference on that, the survey where they kind of determined that, if for those of you who want to find that research on that as far as what the parents' perception is. But there's also, I mean, there are a couple outliers, but there's, in our world, we say whoever you're watching in the Little League World Series over the summer, you probably won't see them in Major League Baseball. And it's kind of hard to find that situation, like if we're talking about, Alcaraz, or you're talking about Djokovic or Federer, like
Tiger Woods,
find them when they were that age. And they were the best in the world at their age bracket then. So what's happening? Obviously these pitchers are getting overutilized at a young age. The other thing with my just correspondence with a lot of MLB pitchers is that most of them get a late start. So the thing you're going to hear across the board, play baseball because you got to have the growth plates open. You got to have, the torsion and the external rotation of the humerus. So you got to be throwing baseballs, but you don't start pitching till your junior year of high school. It's like something you're going to hear across the board. Mm-hmm. So that in itself, I mean, it's funny how like we hear these stories, but we don't change anything. That tells us that we're overworking our pitchers at a young age.
Well, and Kremchek said too, I mean, overutilization of curveballs early when the growth plates are open and mm-hmm. like other pitches along those lines. But then, Brett, you've looked at, I don't know how many people you've watched throw a baseball, but can you kind of educate a little bit on what are the things that you're looking for, or what's the big key landmarks when it comes to the actual pitching motion that kind of tells someone, because the most of the time we're going to find out that people are late. And right. You tell the story, you go to a Little League baseball game tomorrow and you're going to hear dumbass dads in the outfield yelling, stay back.
Douchebag dad.
Right. Well, what does that actually mean when someone is late when they're pitching a ball?
So the one thing, like when I originally started like looking at the mechanics and, way back when I dove in, I remember having a conversation with Pavel and we were just kind of talking and I was kind of, going through some mechanics of some guys who've had really long careers and we were just kind of talking and we started the discussion about early rotation in baseball. Right. And if you look at like what people have been saying, I mean, we're not unique in this thought, but what we are unique in is we're unique in our ability, I feel like in DNS, to explain exactly what the consequences are when we see early rotation and what that means. And now, unfortunately, we've taught enough of it that we're not getting the credit we deserve for which is fine. We're not here to pat our own backs here. But I think we do in this course, we really kind of explain the mechanical reasons of if you rotate early, you lose elastic storage and stretch period. So we could get outside baseball right now. I mean, this is like any, unilateral rotation sport that's involving kicking, throwing, hitting, all of this is going to come back to this early rotation idea. And if you rotate your trunk too soon, then you simply lose stretch in your rubber band. The other thing too is in rotational sports, the default to, if you don't rotate your body well, is coronal plane movement. So whenever, like, if you take the mere mortals like ourselves, not the people who are doing this, getting paid to do this, if you watch their pelvis of their body and you had a bird's eye view of them, you will see they basically move in the rotational plane. So now the reason that's important is because if you can imagine now that you're like the external rotators of your hip joint, and pretend you're a rubber band right now, as you're taking the club back or you're taking the ball back for throwing, you'll feel in your hip, you're getting internal rotation as you're loading your backside hip, but you're also turning your muscles into rubber bands. And this stretch is really, really important to create torque and energy. If you move or slide in the coronal plane, then you lose all of the stretch of the muscles. So now you're just like sliding in the coronal plane to get like momentum to hit or to throw or to kick, but you've lost all the wind up of the muscles. So, forever I talked about wind up at the anterior and posterior oblique slings, which that all is true. But I think like the more I thought about it, the more I taught it, the more I realized like how important the windup is in the actual muscles. So much so in rotational sports, I almost now like think of muscles as like rubber bands almost, because like that's where the energy is, whether it's like in your shoulder girdle, your hip joint. And it's not just about like the anterior and posterior oblique slings. It's also about like the individual stretch. Even like if we're talking about a golfer, you're taking your club back, you're sitting on a tripod on your right foot, your tibia is relatively external rotating while you're winding up your tibialis posterior and your soleus muscle and your gastroc, for example. But if you come off that tripod, then you lose the wind up of those muscles. If you don't have scapular stabilization in your left shoulder in the golf swing, well, you lose the wind up and the stretch and the muscles, like your external rotators of your shoulder joint. So that sounds complicated. We can actually make it really easy in that, like, okay, so what are the markers we're looking for? So the other thing that, if you ever come to a DNS course, you are going to learn the idea of joint centration. If you leave a DNS seminar and you don't understand that, then you literally were not paying attention. Right. But anyway, so then we look like for, just little simple, real, snapshots of like them, and especially in pictures, where what we're going to find is the most violent movement that occurs in all of sports is throwing a 5-ounce ball. So at the moment you're about to unload this cannon, as it turns out, the position of your arm becomes really, really important. Because if we look at what, a lion's share of like professional pitchers are doing right now, they're basically about to unload this anterior and posterior oblique sling. Remember, the most violent movement in sports, with their arm in an orthopedic test for impingement. So like, even like if you just put your arm in this internally rotated, like right now my shoulder's hurting me. Now imagine exploding all of these, all of this elastic storage and energy from these slings that we're talking about. So you're already doing something very violent. Now your shoulder's in this god awful position. And then it's not just your shoulder. It also is, we call it valgus overload at the elbow, which is obviously UCL injury. Mm-hmm. So that is kind of those are the key things we're looking for. Like at that moment when we have full foot load on that glove side arm, at that moment when you're starting to be pulling all the muscles from that support, what is the position of all the segments there? And there's more to it than what we're talking about, but that's a pretty good start,
Great starting point.
Yeah. Cause then, like, especially if you're not into baseball, like at least that the pitcher that you're working with Little Leaguer's elbow is putting himself at very high risk for an injury, and then it becomes age dependent on what their injury is. Although we said like James Andrews talks about repairing UCLs at 9, we you see it, but not that often, especially here. They're a little more crazy in the South about baseball than we are. But I mean, we'll see Little Leaguer's elbow like apophysitis all day long. And then you get older, you get that high school age, and we do start seeing UCL injury. We always
flexor tendon, or we
always say we pray for flexor tendon. It's never flexor tendon, but we pray that it is, or ulnar nerve, which in the differential diagnosis, that's understated in the research. So like being able to seamlessly differential diagnose all that stuff on the fly. And if you do it as long as we have, like you just, like it's almost like you could do it with your eyes shut without an examination. You just listen to what they're telling you. The hard part about the ulnar nerve is you are so used to things like giving paresthesia in your fourth and fifth digits. It doesn't have to do that. And in fact, and I've had a lot of conversations with our good buddy, Michael Shacklock. We just don't see that much, ulnar nerve entrapment. We see ulnar nerve hypermobility that is either subluxing, perching, or dislocating on the medial epicondyle. And it's almost like you can imagine like a rope hanging off a boat dock with weight. Over time, you're creating neuritis, you're causing irritation there. And so then sometimes we have to do an ulnar nerve transposition, which is not the end of the world. You're out 4 to 6 weeks. They tie it to, depending on the surgeon, your bicep or your laceter fibrosis or wherever the hell they tie it to. And then, you're fine. So, yeah.
Well, and I think it brings up a good point too of, I remember you telling a story about George, about Dr. Paletta, and he kind of echoed it on our podcast of a pitcher with medial elbow pain. He said, get the damn MRI because it is so hard to differential diagnose. Now, I feel like I'm getting better at it, you too. But even then, if you have someone high profile or someone that, I would say even less profile actually makes it worse. You have someone that's trying to go out and play their tournament on the weekend and they have medial elbow pain and the dad's asking whether or not the kid can pitch. The imaging sometimes will give you able to drive on that point. And it will kind of rule in and rule out a lot of those different things.
Yeah, because UCL is lupus of the elbow. Like it can be an act like anything. Right. For those of you who work with functional medicine or autoimmunity, like you hate to see lupus because it can be anything. UCL, it can give numbness. It can give you pain on the outside of the elbow. So yes, to your point, a lot of those out there, and myself included, especially early on, what are you doing? You're following your guidelines, right? Okay, so 3 to 6 weeks of conservative therapy. Well, you just lost 3 to 6 weeks. So like if you're dealing with like a potential draft pick or someone's got a college scholarship and you're waiting 6 weeks because some dumbass Medicare guideline is telling you to do so. Yeah. And that's what we all do early on. Then you're like, well, wait, I just got burned on that. You got burned because they got impatient. So what do? They go to the orthopedist, they go to their medical doctor, they order the MRI, then you look like a buffoon. Mm-hmm. So save your reputation. And then you can educate off of that. Like we're well aware that the UCL is a lot like the meniscus of the knee or the disc, where we don't expect your UCL to look perfect. But, if you have a completely ruptured UCL and you're a pitcher, you need an orthopedic consult with somebody who knows what they're doing. We're biased to George Paletta. For those who are out there looking for a place to send your patients, I have the utmost respect for George Paletta for that injury. I would put him up with Neil Altraj, Alchek, Krimchek, Andrews. They're all amazing in their own right, but he is underrated.
Yeah,
in that
for sure. Well, and I think I had 2 patients. They came in literally the new patient on the same day. It was kind of ironic that we were talking about this. This was 2 weeks ago. One had very classic UCL symptoms. Felt a pop, threw a pitch, couldn't throw, like very straightforward. The other one was just like a little bit of a kind of an insidious onset. It got sore, not too crazy. Got MRIs on both. Both had ruptured UCLs, to your point, so like it's kind of like it's such a difficult thing. But I think even if you're dealing with a high school kid, like it still saves your reputation and they're not worse off having the MRI.
No.
As long as you're there to educate them, I think as long as you're there to kind of tell them, hey, this is what we're checking for. This is the reason we're ruling it out. This is why we're ruling it in. Like these are the consequences of this, and this. And then you're able to kind of dictate that care and make sure that they get in the right place at the right time.
Yeah. I always tell, a story where one day, when I was with the Cardinals at the stadium, a guy was doing like a walking external rotator stretch, distinct pop outside lateral joint line, can't duck walk, joint line tenderness, all meniscus. Positive, meniscus. And anyway, so we get the MRI, of course. I look at it, 2 other orthopedists look at it. We're all like, well, he's obviously got a lateral meniscus tear. No. He's got an acute popliteus tear. Yeah. Lateral meniscus is pristine and fine. So in the world of rehab, we become such snobs to say, well, we don't need imaging. We're getting imaging too soon. Michael Shacklock, what does he say? He says the imaging's not the problem; it's the education off the imaging. Right. So like that way, like especially if you're dealing with high level, they're gonna be imaged. So you better understand like how to work your way through that and then how to order the right test. Right. I mean, how many times do you and I in a day see someone else order the wrong test and you're like, how in the hell did you not get this right?
So go through that, Brett. So if you suspect ulnar nerve injury, what's the first thing that you're going to do?
If we're suspecting ulnar nerve injury and we're 100% certain on that, I think diagnostic ultrasound is really the gold standard. The reason being is because an MRI, which is obviously a static test, is just going to be able to show like the neuritis or any kind of inflammation of the nerve. The ultrasound, because we can obviously move the elbow, we can create varus and valgus stress, we can actually see like what the ulnar nerve is doing and whether or not it is hypermobile. And what's interesting about the hyperulnar nerve, and George and I, we might have a little bit of different opinion on this because we asked him on our podcast. He's like, yeah, I've seen pitchers who have had a hyperulnar nerve that, have been okay. Like we see a skewed bunch that's injured. I've seen like over time, it seems like it always becomes a problem.
Doesn't matter if it's baseball or softball. Like right. It's always
like a problem. Yeah. And then like, so it's like 13% of the population has this. If you're not playing baseball, literally it does not matter. Right. Like really kind of a test that's never talked about that I like is just doing a simple push-up. And like, like a lot of you that are listening to this, get down and do a push-up and you can either feel that distinct pop on the medial part of your elbow. Either it's the medial head of your tricep coming over or it's the ulnar nerve. You kind of like...
Or you can almost see it.
Or you can see it. Or you can feel it too.
Yeah,
it's the other thing. Yeah. So that would be the differential diagnosis for the ulnar nerve. If you have a 10-year-old kid, then we actually, which X-ray is a little bit antiquated, but like the X-ray is actually really good to show an apophysitis. And so you can easily run them up to, your local imaging place to see if in fact you have that. That's not a difficult injury, except for the fact that, the parents are wanting their kids to play and they really do need 6 to 8 weeks of rest. And then after that, the pitch count for the rest of that year, I mean, I've had George say like 500. I mean, like it's low. It's crazy low. Basically, you're kind of shut down for that year if that's it. And then if you're suspecting UCL, then that is actually an arthrogram. But keep in mind that, you're rested, you have to rest 5 days after it. If we pump the joint full of fluid, then we can't throw the next day. If we have a regular MRI, we can throw it tonight. So sometimes it's like the situation calls for that where you just got to know. So you order a regular MRI, just kind of knowing. Right. So that's a good example, the medial elbow, where you would use 3 different imaging modalities to see like what's going on. But at the end of the day, like MRI, if you had to pick one, MRI tells you a lot.
I think that's too. If you're young and you're not confident in yourself as far as your differential diagnosis and your assessment, just get the MRI. Like just cut the crap and just do it. And I just always say like, hey, if your kid, and this always makes him feel better, if your kid was a professional baseball player, they'd have an MRI already. And so like, that just forces them to kind of think that way. But then another thing I stole from you is that when you have a 15-year-old or a 13-year-old that comes in with medial elbow pain and their dad is asking them to pitch tonight, the thing I always say is, listen, dude, if you are the starting pitcher for the Cardinals and you have medial elbow pain, doesn't matter what the consequence is, you're on the DL. Yeah, no questions asked. So who are we to say that your 15-year-old kid can go out and pitch tonight?
It makes no sense.
Insane. So I just think that's a new point, and I just always bring that up. Like, dude, you're being a fucking dumbass. Like,
yeah, you're being a douchebag dad right now.
Right. And the other thing I would say too is one thing I learned from George is just overall load too. One thing we don't think about with our little leaguers, our high school kids, is these kids will play in the field and pitch. So not only will they throw 100 pitches, then they'll go play third base, and then they'll throw 20 or 30 balls off a flat ground. And so I think it's always a conversation whether that's with the coach, with the dad or the mom or the whoever, just overall load. Like your kid pitching a game on a weekend and then playing third base or catcher for the entire weekend.
Or I'll look at like my own son, like this past weekend, he's got a little bit of a sore arm. He's kind of lopping the ball over. I'm like, what the hell? Well, they're playing wiffle ball all day long. And I get it. I mean, we want them out doing that, of course, but like then it's like all those things start to, So then like you're not really paying attention. All of a sudden you're like, well, my God, by the time he's throwing warm-ups and he's throwing a Nerf ball in the pool and they played football today, like, okay, so he's throwing 200 pitches a day, you know? So, yeah.
I that's where I think one of the things that have made me successful with these younger people is just like bringing awareness to that. Just like, hey, let's just have a conversation and have a thought process when it comes to weekend tournaments, to your days. Like, let's just think about the overall load that we're having on them. It doesn't matter if it's even football. Like, think about a quarterback. You throw 1,000 balls during the week, and then you throw 1,000 balls on the weekend, like over and over and over again. It's just overwear. It's just too much in the same direction. It's no different than our patients that come in with low back pain. There's not a specific thing usually that causes low back pain. It's just repetitive trauma over and over and over again. Sustained positions, sustained overuse.
And what's unique about that comparison, like if we're dealing with a pitcher with low back pain, as long as there's not like a spondyle or anything like that, it's weird. Like they get better. Like they'll be out pitching. They're like, oh, my back doesn't hurt me anymore. Like they might be, a little bit sore and they can pitch through it. You watch medial elbow pain or shoulder pain, you do not through those injuries. Like you're always worse off for that. Like I never, like if someone's got low back pain, they're pitching through it. Like I'm not worried at all about that unless we are suspecting like spondylo. When a kid is telling me their medial elbow hurts in the back of my mind, I'm like, oh God, this is not good. Yeah. It never is a good thing. You never like throw your way through medial elbow pain or shoulder pain, actually.
Right. Well, let's kind of change gears, Brett. So we won't give it all away, but we may or may not have a kind of a big podcast coming up. And I know you've been thinking about this a long time. And the new epidemic in baseball is not actually the UCL. That's still a problem.
That's a problem, yeah.
But the lat tears. Yeah. So can you kind of explain like what this injury looks like? And I don't know, your thoughts on what's kind of causing it?
That injury was made famous by Jake Peavy. So he was like the kind of one of the first people with like, kind of a big name to have that injury. And and it's no different. Like if you follow lower extremity big tendon injuries, whether that's Achilles or patellar tendon, if you follow these injuries out, and I'm a proud owner of one, like they never are quite the same after they've done that. So anyways, like we put them in that special category where, after they've done that, if you follow these people with this injury, same kind of thing. It's very, very tough. And the reason these injuries are very, very tough is like if you tear your ACL, you kind of have an inert structure that can be like the length tension relationship can be made perfect. Tendons aren't like that. If you can imagine like two ends of a mop or like two ends of a horsetail, they say. So you're trying to get this length tension ratio perfect, which is very difficult to do. That's why like, without totally blowing our cover on who's going to be on our podcast, that's why there's one person in the world that repairs this injury, basically, because they understand the importance of this. So, people will rip their lats. Sometimes they'll rip their teres majors with it. With the uptick in velocity and the importance of needing to throw harder, we just have the arm speed is drastically improved. And with that, how do you get arm speed? It comes down to one of the main muscles who create arm speed is obviously your lat. Now, the most understated soft tissue dysfunction muscle on the body. You've heard me talk about this forever. Almost like a passion of mine now. Lat and lower extremity definitely be the adductors, but in the baseball pitcher, it'd be the lat. There is once you start feeling it, what do you eat? Like I wish I had it's like a tennis ball or a golf ball. Yeah. Call it a trigger point,
or a rope, like a belt. I mean, it's kind of crazy. Yeah.
And so within that muscle, there's inability to share extensibility within that muscle. Therefore, when these people are rupturing their lat, they are more than likely not rupturing it where you're palpating this mess. They're rupturing in the other parts where like it's not able to share the motion.
Musculotendinous junction. Right. No different than in the calf or something along those lines.
Same. Yeah. So then if you take it one step further, then, if you take somebody who you palpate that or you check their flexion, you will see that the default is poor shoulder girdle stabilization, period. Mm-hmm. We're all snobs on what the best exercises are, and we're the worst about it at DNS. Just take that out of the equation and just like you can now group those people into the people that do not stabilize their shoulder blade in the ideal way will be overutilizing their lat. The story I always tell is you're in sixth grade, you're going for the presidential. There's some kid in that class that will literally bang out 40 pull-ups and they literally finally have to tell the dude to get down because it's just like, we get it, bud. You can do 80 pull-ups. Then you got, maybe even a decent athlete in the class.
Yeah, Taylor Premer.
They get up there, dead arm hang. Like if their life depended on doing a pull-up, they couldn't even initiate the pull-up. Well, if you took that kid and no treatment occurred and just through compensation and puberty, whatever you want to call it, hang out in the gym, they could be 20 years old and now bang out 10 pull-ups, all through compensation, all through over-recruiting lat. And that's kind of the best example I have of like, just because you're not doing it well doesn't mean you can't do the activity. You're just going to do it through another strategy. And so, those are going to be those people that we kind of try to like pick out, and before the big catastrophic injury happens. You don't want a lat injury. No. You don't want UCL injury, but you don't want to, honestly, I'd probably take the
UCL.
I'd probably take the UCL.
I think I would too.
Yeah.
Well, I think it just brings up a good point of, I don't know, the game is changing for sure. Baseball has been around for, when was the first baseball game played?
That's a good question.
I don't know. It's been a long ass time. So, but the game is definitely evolving. And I think, one of the things that we talked about in the DNS baseball course is a lot of the technique changes over the last years that have kind of led us to this time and maybe some of the things that are getting taught in your local gym or your local pitching coach that are kind of antiquated because, it's no different than anything. It's no different than I do it like the weight room, like you walk into a high school weight room right now and the football coach is teaching weights because nobody else is going to, and he's teaching the way that his mentor taught and his mentor is teaching the way that his mentor taught. And just because you're teaching it doesn't mean it's the right way. Yeah. And so I think it's the same way with pitching technique. And that's what's so difficult is finding someone that truly understands technique and can actually give good cueing to actually make the changes biomechanically that need to happen. So,
and like Homo erectus was the first hominoid to hurl something in an attempt to kill something or kill someone. What different than Homo sapiens, which we have the ability to, we talked about like the external torsion of our arms and things like that. But like if we gave a caveman a rock and we said, hey, I want you to go kill somebody. Well, you wouldn't like just stand on another rock and like have this perfectly still wind up and then, with a glove on your hand, of course, and then throw something. No, you would take 8 steps. You would have like
you javelin throw it.
Yeah, you'd have like a running approach to do that. So it's no different than like if you went and washed your car today and you were in like a difficult position and you were kind of rubbing or drying off your car and your body was in an awkward position and you're just moving your shoulder, like all that motion is being isolated. You're like, God, that kind of hurts my shoulder. So like baseball pitching is a little bit artificial in that because there's not the best way to dissipate load as if, like if you're actually able to move your whole body and like bring in all the friends, as Gary Gray would say, and let the whole kinetic chain help you. So baseball, it already setting yourself up for you're kind of at a disadvantage that way.
Straight failure.
And then, now, of course, we have the whole velocity movement. Mm-hmm. And, it used to be like when I was young, like, there was 5 pitchers in Major League Baseball who would throw between like 95 and to 100. Now, if you're not throwing between 95 and you better be very deceptive because so that's like been the big change in baseball. So and that's why like velocity actually ends up becoming one of the data points for UCL injury because people are just trying to throw harder. So like, therefore,
what'll be interesting too in the next couple of years now that they've gotten rid of the spider tech and like the sticky substance and stuff like that of how much more we see injuries happen because of people trying to chase velocity where they've lost their ability to move the ball. And like that'll be a very, very interesting thing to watch. And with the pitch clock and some
the pitch clock, you have like the influx of peptides now. We have like, because if you like looked at football this year, we had a lot of patellar tendon, a lot of Achilles tendon, a lot of ACL. A lot of people blaming the turf, but then, we've had turf for a while. So like, okay, is there anything else that's going on? So yeah, it's going to be really interesting to kind of see like what that is. And again, like with the UCL epidemic, what's weird on shoulder pain, we've done a decent job in baseball with shoulder care because even when it's not done that well, like it's done well enough because there's less reported shoulder cases, and the surgeons have gotten smart and they know, like, I mean, we ain't operating on like fraying rotator cuff or like a little bit of a labral slap tear, things like that. Like they've learned, like when they surgically correct that, they come out too tight and they don't have the external rotation anymore. So, you know, we don't operate on shoulders like we did, 24 or 25 years ago. The UCL is, I mean, your only way back really after a UCL injury is through the surgery. So like these players, as long as the right surgeon does it, as long as you wait 12 to 14 months, and as long as you have a rehab that, person that's not a stooge, you're going to get back, you know? So.
Yeah, it is kind of a crazy conundrum. I mean, get your UCL repaired with the Tommy John surgery and get 5 more years on your career. I think
that's what I would do.
Yeah, exactly.
I ain't changing my technique.
No, God no. Yeah, I think that's kind of what you can expect with the DNS baseball course.
But the other thing too is like baseball's a business. So like you've seen me like show those slides like where the cost to a team is millions of dollars, over $2 million. So if one of your players has to have a Tommy John surgery, like there's way more of a downstream effect than you can ever imagine, So, I mean, it's a very, very expensive. And you take, like Ohtani's a good example. So like, he's obviously he is the Babe Ruth of our time. But he can't pitch right now. So like, I mean, that hurts baseball because Ohtani's not pitching right now.
Yeah, he loses a golden age of his career.
Yeah, exactly.
Yeah. I think that's, obviously, today was a good conversation about baseball, and that's kind of a snippet of, we're kind of soft selling you on the DNS baseball course. But I think like the benefit of it is like, it's not just baseball that this applies to. I mean, it is any overhead athlete that we're going to kind of talk about the implications of not having the right centration in your joints.
Yeah.
And I think that is across the board. And that's one of the unique things of DNS. And one of the things that drew me to DNS and draws us continually to DNS is the idea that your neurology is better when your joints are in better positions. And that seems like a very novel idea and a very elementary thing, but I think it's glossed over so much in the strength conditioning world and in the athletic world. Like it's just I don't know. I feel like it's not beating the drum.
I mean, the cool thing to say now is like technique doesn't matter, right? I mean, no matter if we're talking about lifting weights or throwing baseballs, if anybody is listening right now, please listen to me. Like I'm telling you, like
soapbox. There we go.
I understand that whole side of it. I always want to like preface so like we get it. Like there's movement signatures, there's even muscle signatures or satellite cells, things like that, where meaning like every time you squat or throw something, like your brain subtly uses a different strategy. I get it. However, you can still bucket it. And the reason the DNS seminar is a DNS seminar is because if you look at 300 game winners, which there's over 25 of them now, you will see every single one of them will be DNS poster children for what we're teaching in our DNS seminars. Take the over 2,000 MLB players that have had a Tommy John surgery. They're all going to show you decentration in an arm that's late. So, I mean, I not to be the old crotchety old man that's yelling you get off my yard right now, but like, I'm just telling you, the mechanics actually do matter. Now, can you throw with like horrific mechanics and still never get injured? Yes, you can have an iron cable genetically for a UCL. You can just feel your body so well to where like you strategize with your central nervous system in such a clever way to where you never get injured. We're not talking about the outliers here. We're talking about like the lion's share of people. Yeah. So why not just teach people the right way from the beginning? And, like not to name names, but like name your 10 best MLB pitchers right now. When they were young, we could show them 5 different strategies to still get where they're going to go. I mean, so yeah, it's kind of tragic, honestly, if you think about it, that, someone's poor technique has led them to, kind of cost them their career.
Which brings me to my last point. Well, and we'll kind of close on this, Brett. You take a 13-year-old right now with just horrible mechanics, but a great athlete, feels their body amazing, great genetics, everything's amazing. Can you influence it enough and make enough of a technique change to turn them into a Major League Baseball player?
Yeah. So the question is, do you want, I always say, like, I do not want my son to be an MLB player, because if they don't make it, they lose from age 18 to 30. They're not working. They're playing video games all day long. And then all of a sudden they're thrown out in the real world and they're like, oh, wait, I missed 12 years of my life. But like, if you made that your goal, and what's hard about baseball now is like baseball continues to get played throughout the world, Australia, Netherlands, obviously the Dominican, Cuba. So like, it's not like it was where it was just like a Southern American thing anymore. So the chances of, your son getting to that level when it is as close to zero as zero exists. But of course, someone makes it, of course. So your question is, could you create the most perfect environment? They're not like a complete phenom, but could you, and I think that you in baseball pitching, you're still going to need some genetic gifts. You're going to need the right like torsion of not just the twist of the humerus and external rotation, but also like the retro version of the glenoid. Part of that is given you through baseball. Part of that is also given you through just genetics. And then you have this weird looseness that all those guys have. The next time you're with like a really good baseball pitcher, and let's just say you're doing a little soft tissue work on their shoulder, you will feel this weird ability of them to just be able to like, it's almost like their arm weighs 100 pounds because like they can relax themselves so well. Because in pitching, and you've heard me talk about this before, there's no inhibition. You're basically dislocating your shoulder with every throw. So like, it's so I do think there is in softball pitching, I would say the opposite. I would say, show me like a decent little athlete right now. We could create an environment where like we could send them off to college, get a scholarship. And whereas I feel like baseball pitching is a little bit different. Yeah.
Which, I mean, we still haven't done it yet, but it's in the works. I think like we've been kind of toying around with it. You cut your teeth with softball. So, I mean, like most of this information that you kind of started to realize started with the softball athlete. And so I think again, not to soft pitch it again, but you really should come to this DNS baseball course or a DNS baseball course. But, this can be applied to softball pitching. It can be applied to hitting and all sorts of good stuff.
I think like because we've talked about so many different things, whether it's on the podcast or, we're teaching MPI, we're teaching TMJ, like we got so much stuff going on that I have not done justice to the information that is being sat on right now in baseball. I almost feel like it gives me anxiety to think about like,
the hitting prospect. That's another thing.
So I feel like in a way it kind of does get a little bit underappreciated, undersold. So, so I mean, like that's basically my, canvas of like all that stuff. And I mean, you've seen it, like, like anything, like you roll it out, a lot about it in the front. And then like, as time goes on, like, you're like, shit, I need to like change this because I'm not teaching this as good as we could, and then you're like, oh, actually it's pretty good. And then you're like, oh, we need to change this, so I feel like, I'm proud of it. I'm really proud of it. If I would just put my brain on that for the next 5 years of my life, I feel like it would be good.
That'd be boring though, wouldn't it?
That would be boring.
So anyway, guys, thanks for kind of listening to us ramble on about baseball and overhead athletes and throwing things and stuff like that. But we have some great courses coming up. We're still kind of, shaking off the hangover of the DNS World Congress. I feel like we really haven't given that justice either. We haven't really talked about that. We have we need to sit down and just like
that was
discuss.
Kind of like New Year's Day. Like you just feel like I need 3 weeks to just figure out what just.
It was. So stay tuned. We're going to do a podcast where we actually like sit down and break down some of the presentations and what we both took away from it. And Man, it was a special weekend. I feel like we put so much time and effort. It cost me my appendix, I think. It cost me almost our marriages or maybe stuff like that. But
we
that's
Bon Jovi to hotel room.
Yeah, it was insane. But anyway, it was a great thing, and you can expect that again in 2 years. And so around the same time, I would expect around June of 2026 that would be. Then we'll do another DNS World Congress, and then next year we kind of have plans for another World Congress. We just haven't sat down and put it into fruition. And so stay tuned. That's kind of our goal is every year we're going to do some sort of big conglomeration or some big Congress that brings together everybody. Because at the end of the day, that's what Gestalt is all about. We have our biases and we love DNS, and we talked about a lot about DNS today, but it's all about combining things and being able to have conversations with people that may be a little bit difficult and talk about things that maybe we disagree with, because at the end of the day, that's what makes us better. And that's what Gestalt is all about.
And I think, people have probably shut it all off now, but I think we should have put this on the front end. I would just say because basically what happens, I think in your career, I'll just speak for myself on this. You go into what we call a deep dive somewhere. And then you pick your head back up 3 months later and you're like, okay, all right, I'm back. Yeah. Where, you're only thinking in a particular way, whether that's MDT, whether that's DNS or neurodynamics. And then we call it return to the mean, where you go back to what is the normal, right. And you're never off for going on a deep dive. But if you don't go in these deep dives, then you stay too shallow and you don't understand. I always try to put myself into Michael Shacklock's brain, Michael Leahy, when I'm in the middle of a deep dive, Pavel Kolaj or whoever we're talking about, and really try to understand what they were thinking about when they devised their system. And therefore, then you understand how that will fit better in your system. Yeah. To think you're going to be better at ART than Michael Leahy, or better than neurodynamics and Michael Shack. That's insane. So, but if you can understand what their thought process was, then you can really kind of even the playing field, because you may not be Michael Leahy in soft tissue, but you might know all these other things. So therefore you're able to make an attempt to kind of label the playing field. So, and not to leave out any big names, Stecco, Pavel Kolaj, Stu McGill, we see you.
Yeah. All the people.
Lynn Fay. Yeah, we see you.
Well, we got a crazy August coming up, Brett. The summer has been a little bit chill. You leave for the UK.
Yeah, I'll be at ACC in Bournemouth, whoever's.
Yeah, so that's exciting. And then, so we have DNS Exercise 2 in Raleigh with Lindsay Muma and her group. So we're excited about that. Maybe it'll last a little bit longer than 10 seconds of the cold plunge this year.
The way you haze me on that and show everybody that video.
You got a redemption.
If I ever steal your phone, the first thing I'm doing is going to that video and
the redemption this year. If you do it for 3 minutes this year, then I'll delete it.
Okay, fine.
Done. You heard it, Lindsay. And then we have the amazing Marcella Safarova coming in August 16th through the 18th for DNS Peds 1. And I always say, I really didn't truly understand DNS until I took a pediatrics course. And this will make a lot of sense. If you are kind of a hater on DNS and say that, you're just doing baby exercises, the Peds course will explain a lot of the reason why we hold developmental kinesiology to a very high standard when it comes to rehab.
Or if you think you can treat pediatrics, don't come to the seminar, because you are about to be so punched in the nose and humbled by Marcel.
It's insane. And so this will be if you treat pediatrics, period, which I hope you do. It's such an underserved population. Pregnancy and pediatrics is such an underserved population. I hope you come, because it's truly remarkable. It literally changed how I treated.
Well, Marcella too is so unique because she teaches for Voita, and she has basically devised all the curriculum for the DNS pediatric courses. So she is understated. She's the OG in the pediatric patient. So.
Oh, and by the way, in October, Martina, who maybe be the second most underrated person when it comes to pediatrics and pregnancy, is going to come and teach DNS Pediatrics 2. And so this would be an amazing opportunity. If you're trying to build a pediatrics practice or a pregnancy and pediatrics practice, this is a non-negotiable. It has to happen. It has to. It just has to. It's a long weekend. We get it, but this will literally influence how you treat patients every single day. So we hope to see you there. I sent out a reel today about TMJ dysfunction, September 14th through the 15th. And then my personal kind of I'm super excited to be bringing my other mentor besides you, Greg Dorr, which I'm super excited about, which is the functional taping for musculoskeletal injuries. This is probably the number one reason why I've gotten in with as many high schools as I have and treated as many high school athletes as I have, is because of these taping techniques. And I'm super excited to be kind of helping them teach this course, and it's going to be really, really exciting. So anyway, guys, thanks for listening to us ramble on. Thanks for being avid listeners of the podcast. We love you. We appreciate you. Don't forget to visit our sponsors' websites and make sure to use our discount codes. And with that being said, we'll see you at a future course, and good luck with patients. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.